Welcome everyone to today's webinar. I'm Brian Zimmerman with Becker's Hospital Review. We'll begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Additionally, in about a week following the webinar, we'll be sending you a copy of the presentation to the email you used to register. Now let's cover our objectives for today. After this webinar, you'll be prepared to quantify 3 areas of expenses that hospitals and health systems often overlook, reveal how to save in each area, identify the resources you need to take action and save in each of these areas. Let's get started. First, by sharing what these 3 expenses are. 1, procedure trays, 2, freight management, and 3, direct manufacturer shipments. To discuss in depth how each of these overlooked expenses can be a new source of savings, I'd like to introduce you to 3 subject matter experts from Cardinal Health. To discuss procedure trays, we're joined by Sue Champion, Director, Clinical Operations. For freight management, please welcome Brad Wilson, Vice President of OptiFreight Logistics. And for manufacturer direct shipments, we have Paul Farnan, Director of Supply Chain Services for Cardinal Health. With that, I'll turn it over to Sue Champion to tell us how procedure trays can be a source of new savings. Sue?
Thank you, Brian, and hello to everyone who's joined us today in the audience. Now, before I get started about the saving opportunities with procedure trays, I'd first like to provide just a bit of background about Cardinal Health. Cardinal Health is a recognized leader with a top ranking for transforming the healthcare supply chain to meet the new challenges around costs, revenues, and outcomes. In particular, Cardinal Health is a leading medical surgical distributor for surgical hospitals and ambulatory surgery centers. For more than 40 years, we have been a leader in providing supply chain services. That includes helping hospitals and health systems identify new ways to save money without impacting the quality of care. So let's start with those procedure trays. How can procedure trays be a new source of savings for hospitals and health systems? To find the opportunities, we first have to focus on the individual products that are being pulled for those procedure trays. You know, based on my many years of experience as a perioperative nurse, I would estimate that 20 to 50% of these products that are in trays may go unused. Now, how is that possible? To begin with, too many products are often pulled for a given procedure, and open products are thrown away because we all know once you open a product and introduce it to the sterile field, there's nothing you can do with it. You have to throw it away, whether it's used or not. So when you consider that up to 50% of the products from each procedure is going unused every day, you can see how significant those dollars may be that are lost. You know, I have seen many things in my experience as an operating room nurse, but then also since I have been working with Cardinal. And everybody realizes that you're busy. The clinicians are focused on patients. They're not focused on the products at the time of care. Maybe beforehand, but during the time of care, their focus should be on that patient. So things happen without it really being recognized. So it's our job to ensure that they don't have to worry about it, that we allow them to focus on the patient and not have to worry about the components and the supplies. So how can we eliminate the efficiency and save money? You know, one proven way is to optimize those custom procedure trays that you have. By doing so, you'll avoid throwing away unused product, and you will also control costs more effectively and improve your workflow. Here are several steps that you can take. First of all, create a template of your tray components. Include the approved items that you have either on your hospital formulary, your IDN formulary, or even on your GPO contract. and make sure that those components are clinically and economically justifiable and that they're preference items that everybody will use. Once you've looked at that, then you can standardize to reduce cost and improve efficiency. For materials managers out there, that helps you to reduce the number of SKUs that you have to manage, and we all know how that would impact your workflow. For the operating room staff, they'll create less clinical and supply variation. And you know the less variation there is, the more apt you are to be able to focus on that outcome of the patient and keep the quality of care where you would like it to be. And it also includes the efficiency that you have. So if you think about the time of room turnover and preparing for a case, when you're standardized with your component tree, that piece of your daily procedure can track along much more effectively and efficiently. But remember, when you're doing this, you have to always ensure that you're baselining your true cost. You need to include also off-the-shelf items that you add to supplement the procedure tray that you're using. This is a critical step to understand the true cost per procedure so that you can manage it more effectively. If you don't know that true cost, you really are not managing your procedure spend. And the most important thing, get your clinicians on board to streamline the implementation. You know, we clinicians, we're scientists, so we like data, we like evidence. Show them the objective data that demonstrates how optimizing custom procedure trays will improve their efficiency, lower cost, but the most important thing, will not impact the quality of care that they are providing. In fact, advanced data analytics are a critical resource to help you make those informed decisions. And here's how you can benefit from those analytics. It helps to reduce complexity to reveal standardization opportunities. You know, I mentioned earlier that standardization is the key to saving money. When you consider that a single procedure pack can contain anywhere from 30 to 60 products, it is an overwhelming challenge to standardize the contents without data analytics. Data analytics will help you to decrease expenses without impacting the quality of care. You will be able to visualize variations in custom procedure trays and quickly identify standardization opportunities that will save you money while supporting quality outcomes. It allows you to gain clinical support via objective, fact-based evidence. You know, I made this point earlier, but it's worth repeating again. Gaining clinical support is essential for a smooth implementation. Advanced data analytics can give you the evidence you need that optimizing custom procedure trays will help control costs and maintain quality. It will allow you to set inventory levels that are based on utilization and not just a gut feeling or filling a space to its maximum. Data analytics can help you right-size your inventory levels to help lower the carrying costs and avoid those product expirations, which can end up being very costly and impact your quality of care to that patient. And it also helps to ensure that all products are on hand when they need them. If those products that the clinician needs for a procedure aren't where they need them to be, then it doesn't matter where they are in the hospital. They have to be where the clinician can access them.
Thank you, Sue. Our second expense is freight, which you may have taken steps to manage, but are you considering all freight costs? To learn more, I'd like to reintroduce Brad Wilson, Vice President of OptiFreight Logistics. Brad?
Thanks, Brian, and hello, everyone. To better understand how freight management can be a new source of savings, let's start with a fact that may come as a surprise to many members of our audience today. And I first need to preface this by saying, when it comes to freight management, if you're doing something, that is better than doing nothing because you're taking a step towards savings. But again, even when you're managing your freight, there's as much as 50 to 70% of the cost of moving goods to and from and in and around your facilities that actually can remain unmanaged. Now, the individual cost of each shipment might not seem like a lot, but consider all the different departments: medicine, surgery, physician offices, clinics, ambulatory surgery centers, pharmacy, laboratory, maintenance, the list goes on. Each of these departments make daily decisions about moving items in or out or between locations, and it's really easy to see with that level of complexity how costs can add up. So if you're looking for every opportunity to save, freight costs are definitely a low-hanging fruit. You can see an immediate impact right away without changing the products you're using or impacting patient care. In fact, the value of professional freight management grows as health systems grow. It's a key to streamlining complexity and saving money. And when you think about it, you centralize other features and functions. Why not think about a centralized approach to freight and transportation management? So where do you start? One of the keys to maximizing savings is to include all of your transportation costs in your freight management program. Traditional programs only include inbound and outbound shipping expenses from traditional carriers like FedEx or UPS. By adding your remaining transportation costs, you'll have complete visibility to your actual total freight spend. The old saying goes, you can't manage what you can't see, but when you can see it all, you can absolutely better control the costs. So what remaining costs am I talking about outside of those traditional small parcel carriers? I'm talking about things like couriers and private fleet. There can be inconsistent pricing across multiple couriers, and there can be hidden soft costs within private fleets. So taking a deep dive into both of these can reveal not only big savings opportunities, but better synergies and ultimately a higher quality of outcome and experience for your customers within your network. Another saving strategy is to consider centralization of inbound shipments to a single location and then redistributing them throughout your health system. Reducing this complexity can both save time and money. Another way to think about reduction of complexity is to use advanced data analytics to manage not only your total transportation spend, but the total cost of fulfillment. If you think about it, if you knew what inventory you had and where it was, you might make different decisions around how you choose to manage transportation. So data and analytics can help you make informed decisions not only around things like demand planning and purchasing and utilization tracking, but also freight management. So how do you take advantage of these savings opportunities? One opportunity is to work with a professional freight management company that knows how to help you manage not only your total freight spend, but back to those total fulfillment costs that are inclusive of everything. Then you're uncovering every opportunity to save. And so when you think about working with a freight management company, you should think about these factors. Select somebody who already works with your hundreds and thousands of existing suppliers. You want to save money, not disrupt the flow of deliveries. You want a freight management company to already have existing relationships with key suppliers and be able to move quickly to link your information into those suppliers. You want a freight management partner who is an expert in improving supplier and employee or shipper compliance. So you can't save any money if your suppliers or employees or shippers within your system aren't using the program. But when they do, you will see as much as 25 to 40% savings on both inbound and outbound packages. Another element is large freight and same-day shipments. Again, these are often overlooked, but they can be as much as half of your total orders. Large freights is shipments that are over 150 pounds. And again, same day or the term courier are often interchangeably used. Those are shipments that are being delivered within your network the same day and don't necessarily get introduced into a UPS or FedEx carrier network. You want a freight management partner to focus on inventory management and total fulfillment costs, starting with the freight, but back to using data and analytics to include and improve inventory management practices as well. Again, the goal being total and full visibility to your complete spend. And finally, you want a freight management partner to have a proven system for driving savings right away. Again, it gets back to speed and the generation of savings for your overall program.
Thank you, Brad. Now let's turn our attention to the final expense that is often overlooked: shipments received directly from manufacturers. For more, here's Paul Farnan, Director of Supply Chain Services for Cardinal Health. Paul?
Thanks, Brian. To understand how direct manufacturer shipments can be a source of new savings, let's start by discussing the current hospital receiving process. If you've ever stood on a hospital loading dock and watched direct shipments come in from manufacturers throughout the day, you'd have to agree it's a very complicated and time-consuming process. With hundreds of manufacturers that are shipping directly to you, this adds up to thousands of individual shipments across multiple deliveries, occupying lots of your receiving team's time. With all this complexity, there's really no end-to-end visibility from the manufacturer to your hospital. There's a lack of data standards, inconsistent lead times, and overall inconsistent service to manage these manufacturers and individual shipments. Once the products arrive, there's still the challenge then of receiving these products, sorting them out, and redistributing them up to your individual departments or clinical areas, that last mile. What can you do to convert this complexity into a new source of savings? Well, the problem with this model I just described is that each manufacturer is working independently in its own silo, in effect, its own supply chain. What we're suggesting is to save money, you can aggregate these individual supply chains into a single streamlined one. And if you do so, there's some significant benefits to be driven. First of all, by simplifying your receiving process and internal distribution, reducing the workload on your receiving staff, and getting the right product to the right place at the right time. Secondly, by the time saved in reducing the number of touches, this efficiency will yield more savings and free up your resources to work on other areas of importance. For example, special care to your delivery or patient care areas. Next is simplifying ordering and reducing the number of potential errors. Think of all the time that could be saved, all the paperwork that could be reduced, not to mention the number of invoices produced associated with a more streamlined process. There's also an opportunity to establish better PAR levels. These PAR levels and aggregation of these direct orders could also create the potential for some bulk buy savings. And lastly, and maybe most importantly, is the opportunity to reduce freight charges on these direct shipments. Many of these shipments come in overnight or second day air, and these expenses can really add up. How can you take advantage of these savings opportunities? We recommend that working with a knowledgeable consultant to evaluate your direct shipment strategy. There are 4 steps that you can take to reveal these savings opportunities. And number 1 would be to identify those products that can be delivered in a more cost-effective way. And there's 2 obvious places to start. First of all, with targeting high-end physician preference items. Typically, those are found in clinical areas like the OR and cath lab. These are areas where you're getting a lot of direct shipments today, and you can save money by looking at implantables and other high dollar value items that could come into your hospital a different and more efficient way. Also, we'd encourage you to consider taking some items off consignment. Over time, consignment can be expensive and get a little bit out of hand. We would encourage you to maintain the right level of consignment, but look at opportunities to move items off consignment, again, to bring them into the clinical areas in a more cost-efficient way. And finally, recognize that some products should stay direct. We're not suggesting an all or nothing proposition here, but through some of the data analytics we provide, you can determine which items should come in direct and which items could come in a more aggregated fashion. In summary, we've been discussing 3 overlooked areas of expenses today. Procedure trays, freight management, and direct manufacturer shipments can all be new sources of savings for your hospitals and health systems. As you consider your approaches to each of these opportunities, we invite you to talk it over with Cardinal Health. We have an entire team of in-house experts ready to help you evaluate your savings opportunities. We have deep experience in identifying unnecessary expenses and procedure trays, freight management, and direct shipments from manufacturers. As a result, we can help you free up substantial resources both time and money that can help redirect your focus on improving patient care.
Thank you, Paul. As we wrap up our discussion today, I'd like to once again thank Sue, Brad, and Paul for sharing their experience and insights. I'd also like to thank you, our attendees, for your attention. Please take a moment to complete the survey that will pop up as you leave the webinar. Your feedback is invaluable in helping us continually improve the value you receive from discussions such as this one. We'll now be happy to answer your questions. And we have our first question here for Brad. Brad, for someone that's already started to manage their freight spend, what do you recommend?
Well, Brian, it's a great question. And I think I'd go back to what we talked about a little bit earlier in the sense that I'd make sure you're looking at your total freight spend. Again, traditional programs sometimes only include inbound and outbound shipping expenses, again, tied to those carriers like FedEx and UPS. You should really be looking at the total spend, that courier or same-day expense, as well as private fleet. And also remember to look at large freight as well. That's shipments over 150 pounds. All of these elements I just mentioned could be as much as half of your total freight spend that's really gone uncoordinated and unmanaged.
Thanks for that input, Brad. We've got some more questions coming in, and we have one here for Paul. Paul, which items should I start with from my direct shipments?
Yeah, through some data analytics, we typically land on items that are most frequently purchased from a volume or turn standpoint, as well as items that have significant dollar value. So as you look at products that have the potential of expiration, we pull those together: high value products with expiration and items you buy most frequently. And that sort of 80-20 rule, looking at those items that drive the most activity and the most expense, would be key areas to focus on.
Great, thank you, Paul. And now we have a question here about procedure trays. You want to take that one, Sue?
Sure.
Sue, do you have any additional tips on getting clinicians on board with optimizing procedure trays?
Yeah, as I said before, the most important thing is to make sure that you involve them early and you involve them early on, even in the planning stage, not necessarily after you have a plan in place. But talk to the clinicians because they know better than anybody what are the workarounds that they're already doing, where are the inefficiencies within their processes, so that they will tell you where they feel that there is the ability to make it more efficient and to save costs. But the earlier you bring them in, the better that you are and the more buy-in that you would typically have.
Great, and we have a follow-up question here for Sue. How are the physician preference cards related to the custom procedure trays?
Oh, that's a really good question. You know, the custom procedure or the physician preference cards, I always call them the engine that drives the supply chain for the operating room. They are the list of everything that is being pulled and used for a procedure. So if those cards are not maintained and they're not updated when you make changes to the kit, then you have your inefficiencies and you have products that are still being pulled and opened when they already are involved in the kit. So that is the biggest roadblock that I see, is that as you're making changes to the custom procedure trays, you have to make sure that those same changes are coming over into the preference cards. Direct relationship for those.
Thanks, Sue. And now we have another question for Paul. Paul, do you find that manufacturers are willing to offer bulk buy discounts in the new process that you're describing?
Absolutely, and this can be the source of some really significant savings. As I mentioned earlier, the real emphasis of the program is aggregating shipments, aggregating orders, and that certainly creates an environment for bulk buys and negotiating bulk buy discounts with direct manufacturers. So this can be a real tremendous savings opportunity and benefit for the hospital.
Thanks for your input, Paul. And Brad, we've got a question here for you. We have been considering moving to a self-management model. What is your perspective regarding this direction versus working with a professional freight management company?
Yeah, Brian, it's a great question, and it's one that is on a lot of folks' minds these days, especially as health systems are changing and growing. I think I'd highlight, there are many areas, I think I'd highlight three to consider and compare. And I'd repeat a sentiment I mentioned earlier, first and foremost, that taking an active approach toward managing your freight expense is a positive step. The cost of doing something is well less than the cost of doing nothing. But with that said, when you're considering balancing a professional freight management partner versus a self-management model, let me highlight, again, 3 points that you might consider that weigh in on the side of the professional freight management partner. Probably first and foremost, freight is not a set it and forget it process. It's very dynamic. It's always changing, just like you think your system is changing. So to drive really long-term success, both active and effective management really require constant attention, vigilance, adaptability to the changes and dynamics of your hospital and network. I'd say, secondly, working with a professional freight management partner allows for that partner to share best practices with you, measure improvement trends, and performance benchmark you against peer-sized institutions. Your freight management partner many times has the benefit of seeing multiple practices in multiple markets and multiple types of settings and bringing those best practices back and making them a reality for you. And I think, again, there's many points, but the last one I would make are terms like compliance, standardization, analytics, and most importantly, service to meet the needs. These are all focal points. If you think about freight management in totality as a strategy and you do it proactively, it can have a substantial impact on both savings and value. As a hospital supply chain professional, you have enough on your plate. So with a professional freight management partner, this is all we do with a full-time focus and eye towards resources, insights, and constant improvement.
That is great insight, Brad. Thank you. And with that, we will wrap up our Q&A. If you have any other questions, please contact medicalservices@cardinalhealth.com. I want to again thank our presenters for that fantastic webinar and to our audience for joining us today. We look forward to having you join us for future webinars.